Welcome to Bambridge Medical Arts. Today I'm going to show you how to use cupping therapy to treat for digestive disorder. At first, I'm going to show you how to use cupping therapy to treat for nausea. When you feel nausea, you can use the cupping therapy to apply on your belly to relieve nausea. This is how you do it. At first, you need to find out where the point you're going to use. You need to work on it. The most effective point should be between in the middle of your belly button and your chest bone. Okay, in the middle, right in here. See the line? You can see the line right in the middle. So what you do, you need the cupping, a little cup right there. You put pressure on that. See, you leave it on for 5 to 10 minutes. You may have the bruise mark later on, but the longer you leave it, the more chance have bruise. If you have bruise, you need to wait until the bruise is gone to apply cupping on this spot again. Otherwise, you may have permanent mark. If you don't leave that long, you can just put pressure, then release, and pressure and release for 2 to 5 minutes. When you do this pressure and release, you need to feel the sensation of the cup. It's too light, not going to work. Or too hard, it's too painful to handle. But you got to feel the sensation, and that sensation will help you relieve nausea. Okay. So if you do it every day, you can do this as well. You put pressure, release, pressure and release. That way you won't have a bruise. Then you can do it multiple times, even a day, or you can do it every day. But if you have bruise, you wait until the bruise is gone. Otherwise, if you still want to have cupping therapy, or if you already have the bruise, but then you still can do it. You can move the cup up or down one spot to avoid that bruise area. You can go up or down, or you can go on the side. Okay, as soon as you cupping the belly button and your chest bone, the whole area, as soon as you cover the whole area, you can relieve nausea, because the cupping therapy work on the meridian. You don't need it so accurate like an acupuncture and putting the point. So you just need to work on the whole area. So usually when you do right, you should feel some relief right away. So if you treat for the IBS, you need to add more point. So not only this point, also you need to work on another point, like 4 finger away from your belly button. We call it tianshu. Yeah. So you need to put a cup on that spot. Then you put the pressure on it. Then you put another one on the other side. Okay. You can leave like that. It don't even have to be accurate as soon as the area you can cover. Okay. You can leave till 5 to 15 minutes. The longer you leave it, the chance you have bruise, the higher. Well, if you leave it more than 15 minutes, you may even have blisters. That is not what we wanted. Okay. If you have bruise, you have to wait until the bruise is gone to apply next therapy. So if you do just pressure and release, and pressure and release for 2 to 5 minutes, you can get a good result as well. well, without leave a bruise on your skin. When you do the cupping therapy, you need to feel some sensation, some pain, but it's tolerable. If you don't have sensation too light, it will not work that well. You need to feel that sensation. That sensation will give you some nausea or pain relief. Partially, when you have IBS, if you bloated and feel gas and bloated, it can give you some relief right away. Also, someone have diarrhea or constipation, it can help you relieve that as well. But you need to do it. If you have bruise, you can do once a week. If you don't have bruise on the cup, that if you have more time, you can do it every day. You do at least once a day. You can just use press and relieve, press and pressure and release, pressure and release. You can do that like 2 to 5 minutes each spot, like the middle of your belly, this spot, yeah, and right in here. You can do it. This 3 spot can help you relieve IBS. You can do it. You can do it multiple times a day, or just at least once a day. You need to do a few weeks, or even a month. But when you have a cramp, when you have bloating, have nausea, if you do this on the spot, most likely get some relief right away. But for long run result, get a better result, last longer, you need to do it more often. Be consistent for a while, for a few weeks, or even for a few months. Also, you can use cupping therapy to treat for ulcerative colitis, or even Crohn's. So then you need to add it on top of the point used on IBS. Then you need to add one more point or more point. Okay. So when you have colitis, most likely have some pain and cramp or inflammation in your colon. So you need to press around, lay down, and press around your belly. Feel where the most painful area. Most likely, most people have is this spot. People have a little bit under the tianshu or on the tianshu area, have some pain right in here. So you can use the cupping therapy on that spot, like pressure, release, pressure, release, and pressure, release, or 2 to 5 minutes. Or you can leave it. Pressure, a good sensation, discomfort, pain sensation on the spot. Good pressure for 5 to 15 minutes. You also can do that. You can leave bruise, you can work better. But if you want to use again, want to treat for again before the bruise is gone, you can use the point next to it. This way or that way, up or down. You can use around it. As soon as you cover the whole area, it's good. You work on the meridian. You not just work on acupuncture point. You don't need to be so accurate like acupuncture. You have to put a special needle in a special point. You can just work on the whole area. After working the front, if you have IBS, nausea, or ulcerative colitis, or Crohn's, you also can work on your back as well. To work on your back, you need a connection, because you need 1 tool like this to connect it, because it's hard to work on yourself with the cupping. It'd be difficult to pump the air out on the back. So use a connection like this, it will be easier to do. So you connect here, then it's ready. Okay. So when you work on your back, you need to move your cup to reach as high as you can in the middle back. Then from there, along your spine, all the way down to your tailbone. You need to use called roll cupping therapy. You line up the cup one by one. You put pressure, then release, pressure, then release, one by one along your spine, all the way down from your middle back as high you can reach the spot down to your tailbone. This is how you do it.